A warm welcome to all our viewers to our series, Natural Medicine. We are so lucky here in Switzerland that we have a clinic here that is focused on holistic medicine, naturopathic, complementary medicine. And I invited the lady that is in charge of the Swiss Moutain Clinic again today with a very important question, which is, can one or can she treat fibromyalgia, so chronic pain, effectively? Or is it not treatable in academic medicine or in a holistic way? That was my question. A warm welcome, dear Dr. Petra Wiechel. Thank you for coming.
Thank you for having me.
My pleasure. My cousin also has had this for 40 years already and is suffering everywhere and keeps having treatments and this and that and so on, but she literally tells me not curable.
Good. I would never claim this for myself, to say not curable, and first of all, I have to say, we are not treating fibromyalgia because it is a disease pattern that we do not know. It is just a word for a pathology, which means chronic pain. And this is where the work of a biological or complementary practitioner begins.
Detective?
Yes, detective. Recently a patient said to me, "You are not a doctor." And I said, "What do you mean?" "I think you're a human criminologist." And there it begins, that you find out so much about this person that you first determine from the medical history. Where are they from? How were their lives? Where have they been abroad? Today we have, I would say, almost 60% have a toxic, chronic toxoplasmosis that they don't know about. It is a parasitic disease transmitted by cats that can also cause fibromyalgic symptoms in joints and muscles.
Is this known, or do you know this?
Well, I am motivated by the thought, if I don't know something, I need to find it out. But the worst part for me is the word chronic. I am not using it. And all these things of a person with chronic pain only means that the body has to react to an inflammation.
Can I use the word chronic again? Does that mean, from your experience, nothing is chronic if you're trying the holistic way?
Yes. Well, I am not saying that it is easy to relieve someone from a chronicity, but I just want to underline that an acute disease, an acute inflammation, is a body's response to a process that it is working on. And then that's it. Acute infection, acute bronchitis, and so on. But a slow development to a disease that manifests itself found requirements in the body to be able to develop there, and processes add up. It is like the known camel's back of causes, that at some point has too many straws to compensate, and then all of a sudden the camel's back breaks and the illness appears. So a lot had to happen. And if I'm looking for a chronic pain syndrome now, then it will never happen if I don't start to look what is happening with the bowel. Because if the bowel has a permeability disruption in the intestinal mucosa, it transferred all these so-called lipopolysaccharides, which are fragments of bacteria. It transfers scatol, hydrogen sulfide, parasites into the blood. Now its duty is to attack only via the immune system and to somehow destroy this bacterial, viral, parasitical load with an inflammation.
That is the first step to get this stuff out, isn't it?
Not only to get it out, also to close the door in the bowel, because what is allowed to enter basically has to be checked 3 times. Otherwise, it has to take the way out. And there is so much happening here that sometimes basically what is down here is really only shit. So if this membrane is not closing the filter and is only filtering what comes in, then I don't have to be surprised that my immune capacity is constantly increased and at some point says, that's it now. It is not possible that we also compensate this. So parasites, bacteria, fungi, mycotoxins, so mildew and so on, this is all contamination that will also be too much for a healthy immune system if the chronic contamination continues. That is number one. And people don't know it at all. They don't know. They live with a dog, they live with a cat, and they don't know that they have parasites that may be attracted to the muscle fascia, that parasites lay 100,000 eggs per day, release larvae. They don't see it because it's not visible for the human eye. And it is also not traceable medically. You can make a stool analysis for parasites 3 times a day. If they're negative, you don't have them. You can have a value tested in the lab, the so-called eosinophils in the blood. If they are negative, you don't have parasites. And that's it for parasites. So the parasite never burns down its own house. If it is established, then it stays quiet, reproduces, and still keeps quiet, but consumes and of course causes an enduring immune presence. So this is also a big part of the clarification of a chronic inflammation pain syndrome. The other one is the bowel. The third one is of course that we have toxic contamination, and what we will do in the clinic from July is working with environmental apheresis, which is a dialysis method with a special filter. And then we're able to discharge solvents, pesticides, herbicides, glyphosate. So it takes 2.5 hours, and as part of a diagnostic process, we can find out things that we can't find out now. I don't have a good diagnostic base to get to these environmental toxins, and we have to face these things. By the way, an apheresis also filters out rheumatoid immune complexes so the rheumatoid events can be reduced.
So rheumatoid episodes, this pain, can be reduced by it?
Yes, these are things, and that it is important. If I, for example, develop a chronic inflammation pain syndrome, that I have to see which inflammation cytokines are increased, which ones are constantly overwhelmed. That will give an indirect hint to a chronic viral bacterial contamination. It is extremely important that I also check my anti-inflammatory mediators that I have myself. Enzymes are anti-inflammatory that the pancreas produces, a high dosage of vitamin E that I take in with a lot of nuts, reduces inflammation, omega-3, salmon, linseed oil, highly anti-inflammatory. And all these things, that is one thing to recognise what is triggering my pain every day and what is my body lacking to be able to adequately regulate and inflammation. And I have to say that I really don't have a concept that I pull out of a drawer and say, oh, you have fibromyalgia, a disease pattern that I don't know, but you have pain. Let's see what caused it, that your body is not able anymore to somehow control a chronic inflammation. And from there on, I'm building I call it the personalised therapy concept, which is different for every person that suffers from fibromyalgia.
I learned so much again. I really thought it was a clear disease pattern. But it is basically just chronic pain, which has a cause somewhere, and this has to be identified. You mentioned parasites. I heard a lot from that lady, what she has done. She's done a lot, but I hadn't heard about that before. Therefore, she hasn't done it. Is it really possible to discover the parasites?
Yes. I really paid attention years ago. when a colleague presented 5 tumour cases that had finished therapy. And all 5 cases were healed. And he had them go through a big parasite programme, because that is the art, to recognise which parasite lives off the other, which is providing a nutrient medium for the other. These are very developed therapy protocols. So based on this, and it has basically shaken me and kind of gave me a small key that I was missing in the past. And all the big parasitologists in this world, they are doing energy testing. With bioresonance devices, they can determine the parasite's resonance. And we have our Frederick Dr. Junior Wiechel, which has been greatly introduced to that and is able to exactly determine which contamination we have. And the next thing we do is trying to get the parasite out of its reservoir, which happens also as part of a protocol for a long period of time. Sometimes it's weeks that people need, because from the 100,000 eggs per day, larvae hatch. And we also have to consider the circadian rhythms. And the parasite is the one that, of course, interferes with the hormonal system, interferes with the neurotransmitter system, interferes with the immune defence, and also partly stops it in the tumour defence. So we have to clarify the question, and we have to do it on time. And then we have to start the therapy. And nowadays we always have to include the antiparasitic therapy in a prevention. That is my observation of the last 3 years, not only because A, the people are not protected anymore, they don't have enough gastric acid through the high usage of this gastroprotective medication, even though it is our life acid. There is no other acid that the body produces. All the others are metabolism products. Acetic acid, gastric acid is the only one, but it also has a task. It is antiparasitical. The mouth has the task to take everything in. The stomach, first of all, too. It doesn't care what comes in or out. It has to take in. Its duty is to supply, but its duty is always also to protect. And only with this high acid pH value, it is first of all decided in the stomach that parasites have to be destroyed. If that doesn't happen, then you invite them all in. And now it is also up to the bowel, which is already pre-contaminated through the glyphosate or through gluten. It already has its silent chronic latent inflammation. So this parasitic spread is somehow not a problem, especially because the parasite chooses all the niches and attaches itself to the coronary vessels, the hookworms. You just need to walk barefoot through the garden once. So these are very exciting things that we can see and that people sometimes visibly release for weeks. The feedback is often incredible. And also the photos they send. So this really is a serious topic because we don't show the defence anymore in this regard. Parasites are part of our life, and a healthy parasitic load, I think, is good and smart because it challenges our immune system. But the parasite is also protected a little bit because with a certain size, the immune system can't do anything with it. So these are serious things, especially as part of chronic pain problems.
So again, about these parasites, is that something that has a medical, substantiated, scientific base? Research area? Nothing?
Not yet.
So you've learned this for yourself and some other doctors too, but everyone has to search for themselves.
Yes, at least it is not part of our, let's say, of our everyday life. We don't notice it. And we know, for example, through a researcher like Lebedewa about the trichomonads, the protozoans, and she really brought 12 scientific proofs which tumour metabolism does the tumour cell have and which does the the trichomonad have.
I've read all of her books, but you were the first one mentioning her today.
Yes, but she never had professorship. She's hushed up. She never got a lab. She's a chemist. But there were lots of gynecologists that have used her knowledge back then and also quoted these books, yes.
If you implemented all the things that she scientifically documented, will you get the results?
We can see a lot, sure.
But in my opinion, there are too few of these clinics like the one you're directing, where all these chronic diseases, and it is a widespread disease, there are so many people that apparently have to live with this pain, which now could get a bit of hope.
And the thing is, I was a young doctor and I sent patients to a special consultation. There was a special consultation for fibromyalgia, and they came back with a letter and the standard medication. Antidepressive, relaxation and painkillers. So I sent 3 patients to this consultation and 3 times I got this letter. And then I thought, this is not the way. I have to understand it. And then you will also get the answers if you're looking for solutions and ask questions. But as I said, I think the biggest mistake is that we think a disease has a name, so the disease needs this, the therapy. In medicine, we call it guidelines that we have to follow. But we also have to know they only begin at the developed product, not at all on the base. And if we only push from the top, if gastric acid, which of course has a reason that it is produced more than what is needed, this also has so many causes that we need to know to bring this physiological process back into balance. It's like putting a lid onto a water spout fountain. Of course, if you take it off, first of all, the body's response is to produce even more. That is not that bad. Now it needs the knowledge and it needs the consequence. And if I say, for example, a lot of inflammation at the mucosa is caused by gluten, then it is already so precious to shut down this factor so that the development is not encouraged any further. Especially because this pantazole also causes heavy lack of vitamin B12, and with that, circulation problems, dementia, all these things are triggered. And I think it is important that we, as doctors, inform the people in this direction, truly inform them, and not just pointing the finger and say, do it, but explain to them what they do, but also what they don't do. Francis of Assisi, I think, and in that moment, it is just beautiful.
Can I say something about the gastroprotective medication again? So many people are taking it today. And what I understand from you is that it's a disaster to take it.
Yes, I think it's not just a disaster. When they were released, it was a colleague from the university where I studied. She was involved. And I was grateful because we now had medication to lower the gastric acid just for a moment. For people with gastric ulcers or a duodenum, it was a blessing because these cause incredible pain. When they were released, we all got trained. No long-term use it for 14 days, 3 weeks, but definitely not more, because the whole milieu between stomach, small intestine, liver and pancreas is finely synchronised, so that this precious gastric acid that is produced through the bowel at the same time also builds the bicarbonate, which has buffer characteristics for the gastric acid itself, that the stomach is not digesting itself, but also to buffer the blood. The blood has a pH value of 7.4, and the body is not up for discussion from the first to the last breath if it is in danger. So it invests the energy, but for that it also needs sodium bicarbonate. So if you're taking pantazole...
Thank you, go on.
If you're taking pantazole, then also the sodium bicarbonate is blocked, so it has further consequences. And today, Pantazol is, I was shocked that you can buy it over the counter without a prescription. And I'm shocked that without thinking, it is just prescribed as long-term medication. I'm shocked that this pH value is increased, becomes more basic, and then the stomach is not functioning properly. And I see people that are always complaining about these things, that take a lot of Pantazol, that have no more gastric acid. Then we have to slowly start to somehow bring the stomach back to its old milieu.
That takes time.
That takes time. Sometimes it is also people that say, I eat and I eat fast. I am not pre-digesting at all. And by eating so fast, the stomach gets such a strong impulse that it gets used to it. And eventually we first of all get a misinformation, then a misregulation, and finally it develops a dysfunction. And then we have to analyse what caused it. The other thing is also the parasitic contamination of the stomach that forces this gastric acid, because the gastric acid is an opponent for the parasite. The body needs the gastric acid to destroy the parasites. If you don't recognise this, then you can't do anything about the parasitic contamination. You take something precious away, what your body can't do anymore.
And there is no chance that the chronic pain will be reduced.
Well, how?
Oh dear, oh dear. On the one hand, I am very happy that I was able to get to know you. It's like having a small insurance if there is something in your life.
Oh, how nice.
Then I know where to go to get a holistic approach. Like you said, there are very, very few gifted people, doctors, that really live like this, with all this empathy, which is also incredibly meaningful for the well-being of a person that is suffering from chronic pain. I will forward this video to my cousin, hoping that she will look at it in depth and also has the chance to somehow get rid of the pain, because she tells me it's just getting worse and worse and she has to live with it, and finally it will lead to a very bad ending. And sometimes she can hardly walk, and the fingers, she has these episodes. But there is still hope, and I am so happy to hear that. Again, thank you so much.
My pleasure.
It was a pleasure. And to you, dear viewers, I hope you also listened well. On the one hand, about the gastric acid, about the stomach, what we clearly heard today, but also, on the other hand, what I also clearly heard, we have to look at chronic diseases in a holistic way, and there is no reason to say that we have to live with it. There is always a way and hope and a solution. And we heard there are systems for solutions, and Miss Dr. Wiechel in the Swiss Moutain Clinic is a good address that can hopefully also help you on your path. That's it for today. Thank you, all the best to you, and see you next time.